We are a small rural hospital that often treats children with bronchiolitis. When advanced respiratory support is required, they are often medevaced out of province. High flow nasal cannula is being increasingly used in the treatment of bronchiolitis, and I wanted to find out if it is effective in treatment in the hope that we could reduce our rate of medical evacuation out of province. A 2018 statement from the Canadian Pediatric Society concluded that currently there is insufficient evidence to support its routine use in bronchiolitis. A 2013 Cochrane Systemic Review also concluded that there was insufficient evidence to recommend its routine use. A search of single studies in the last 3 years found 3 RCTs, 2 comparing high flow to standard oxygen therapy and 1 comparing high flow to nasal CPAP. They concluded that high flow reduces the number of treatment failures but does not shorten duration of oxygen therapy or have the same success rate as nasal CPAP. There was also a conclusion that early use of high flow reduced the rate of escalation of care due to treatment failure. My recommendation is the implementation of a pediatric early warning system on the ward and emergency department in our hospital to facilitate early intervention in bronchiolitis and prompt consideration of high flow to reduce escalation of care and subsequent medical evacuation. PEWS is a validated clinical tool that scores children based on their behavior, cardiovascular, and respiratory systems, and links those scores to an escalation algorithm that prompts early intervention. A 2017 systemic review of PEWS found evidence of positive trends in improving clinical outcomes for clinically deteriorating children. A few barriers have been identified in other PEWS rollouts in other hospitals. First, the nature of the practice change and how it's perceived are critical to success. Some nurses harbored doubts about the effectiveness of PEWS and had concerns about the extra charting involved. Proper education about the validity of PEWS and integration into the electronic record were found to allay these concerns. Concerns from nurses were also expressed that PEWS is a replacement for clinical judgment and decision making. It is important to stress that PEWS is a tool to support nursing judgment and not replace it. This change also requires buy-in and support from a large number of stakeholders, including senior pediatricians, the nurse educator, respiratory therapists, and nursing leaders. It is important to identify these people and engage them early in the process. PEWS is also a large organizational change, and as such will require the formation of an implementation committee with the support of formal leadership to be successful. Thank you.